Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response. And true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Hi, and welcome back to the Vital Spirit podcast. I'm Dr. Kelly Livingston, and today we're diving into a question that I get every single day. Actually, a few questions. One of them is, are you a nutritionist? And then the classic, oh, so you do homeopathy, or do you practice functional medicine? And listen, these are honest questions. The truth is that even people within the health and wellness space are often unclear what naturopathic medicine actually is. And as naturopathic doctors, we all practice differently. A lot of it, as you'll hear me talk about in a few minutes, has to do with where you were trained, what school you went to, who was teaching at that school at the time. So I completely understand that there can be some confusion around this. Today, I want to not only explain what makes naturopathic medicine unique, but I really want to bring you into the deeper why behind the way I practice. And that's because the difference isn't just about credentials or modalities, it's a difference in worldview. I tried to set the stage for this in the first couple episodes. So if you're new to this podcast, please go back and listen to the first few episodes where I do talk about the principles of naturopathic medicine and the therapeutic order. We'll explore in this episode what separates naturopathic medicine from functional medicine, nutritionists, and homeopaths, and we'll get into the foundations. We'll talk some more about the therapeutic order and vis medicatrix naturae, and why this medicine is relevant now more than ever. I decided to do this episode because I was speaking with a patient who's been a patient of mine for over 10 years. And she was making a statement around how she didn't understand how there wasn't more cohesiveness or communication in the world of medicine that she was experiencing. And I really was trying to explain to her that I think a lot of it does come down to this difference in paradigm and this real difference in philosophy or understanding of how the body heals and what the role of symptoms really are. So before we get into all of that, let's talk some more about the roots of naturopathic medicine. Naturopathic medicine is a distinct system of primary health care that combines traditional natural therapies with modern scientific knowledge to emphasize prevention and support the body's inherent self-healing abilities. This is a real key distinction. Modern naturopathic medicine was formally established by Benedict Lust in the early 1900s, but its philosophical roots go back to the ancient systems of healing. We got so deep into this with Dr. Z. I'm so grateful that he came and joined us to have that conversation. So go back and listen to that episode as well if you're curious about the roots of herbal medicine. And these ancient systems of healing, so Greek medicine, Ayurveda, Chinese medicine, and the European nature cure movement are really the foundation of naturopathic medicine. These systems all held in common a fundamental truth, that the body has an innate ability for self-healing. It has the capacity to heal, and that disease is not an enemy to be vanquished, but a signal to be understood. Symptoms are messages, right? We talk all about how the body heals here at the Vital Spirit podcast. One of the most influential thinkers in the early naturopathic movement was Dr. Henry Lindlar. In his 1919 classic, The Philosophy of Natural Therapeutics, Lindlar wrote, "Every acute disease is the result of the healing effort of nature." That line is worth repeating. Every acute disease is the result of a healing effort of nature. The fever, diarrhea, your rash, these are not malfunctions. They are the body trying to correct itself and communicate to you. This perspective is at the heart of what we call vis medicatrix naturae, or the healing power of nature. It is the vital force, not simply in a poetic or energetic sense, but as a real observable organizing intelligence in the body. Naturopathic medicine is rooted in this respect for life's intelligence. It's a blend of vitalist philosophy and natural law, scientific rigor and evidence based medicine, and clinical tools that range from herbs and hydrotherapy to physical manipulation, counseling, nutrition, and homeopathy. What makes our education distinct is not just the modalities we learn, but the philosophy we're steeped in for 4 years. We're taught to think like nature, to follow patterns, to observe cycles, and to trust in the body's innate movement toward balance. This trust is not naive. It's rooted in a framework called the Therapeutic Order, developed and shared by doctors Jared Zeff and Pamela Snyder. It provides a hierarchy of clinical decision making. This is especially helpful when you are a new physician practicing naturopathic medicine. We've talked about this before, right? Number one, we remove the obstacles to health. We remove those obstacles to cure. Number two, we stimulate the vis, that vital force, that healing power within. Number three, we strengthen weakened systems. Number four, we correct structural integrity. Number five, we use natural substances to restore and support. Number six, we use pharmacological intervention only when necessary. And number seven, we use high force interventions like surgery last. This is an order that we work through. Now, you may be utilizing things in different levels of that therapeutic order right when you work with someone, but there is a process. There are steps that we work through. And no matter what, we are constantly coming back to the philosophical tenet of first do no harm and respecting the body's ability to heal and asking the body what it needs. So this order is not rigid by any means, but it reminds us to support the body's capacity to heal before suppressing its symptoms. We're trained to ask questions like, what is the body attempting to do here? What healing process is already in motion that we can capitalize on? What would happen if I supported rather than suppressed this expression? We don't practice green allopathy, right? This is a radically different way of seeing health. I'm not just running a lab and giving a supplement to replace what was low in that lab. There's a lot more going on than that. A lot of the times when I'm working with a new patient, our first few visits are really centered around me educating patients on these different paradigms and different ways of looking at our health. So the principles of naturopathic medicine do include, as you know, if you've listened to that episode, doctor as teacher, right? So a lot of the education that I'm doing with patients is around not looking at symptoms as things that we want to get rid of or suppress, but really starting to get clear around what our bodies are trying to tell us, what our minds are trying to tell us. Now, what is the difference between functional medicine and naturopathic medicine? Well, functional medicine is a term that's become very popular, especially in online spaces. It emerged in the 1990s, through the Institute for Functional Medicine, or IFM. And that was founded by Jeffrey Bland. And it was really a way to bridge the gap between conventional and integrative care. So functional medicine providers focus on systems biology, lab-based diagnosis, and often use food and supplements instead of drugs. So there's so much to appreciate there, right? Functional medicine has helped put concepts like gut health, inflammation, and root cause investigation on the map for sure. But here's where the conversation needs some nuance, I think, and that's functional medicine came out of naturopathic philosophy of root cause care. But many functional practitioners do, I think, lack some of the vitalistic lens or therapeutic sequencing that really defines naturopathy. So while functional medicine might ask, what are the upstream factors contributing to this disease? Naturopathic doctors are also going to ask, is this the time to intervene? How do we work with the patient's terrain and not just impose a protocol on it? And it's not uncommon for patients to come see me with binders of functional medicine labs, with results, with supplement regimens, and they're still symptomatic. They might still be feeling depleted and still disconnected from their bodies. And I do think that this can be what happens when we apply a reductionistic, test-centered approach to root cause medicine. And yes, again, you'll hear me talk about labs, but that's just a piece of the puzzle. The difference is not just in tools, it's in timing, it's in tone, it's in trusting our body's innate ability to heal. Functional medicine, in my experience, does tend to focus on systems biology and data heavy protocols. And it does emphasize lab testing and really treating dysfunction through nutrition, supplements, or dietary intervention. So the philosophy is a little bit more rooted in biochemistry and aims to restore balance in targeted ways, which is great. We want to restore balance, but sometimes it fails to recognize that the body actually does know what it's doing as well. So naturopathic medicine, on the other hand, is rooted in the therapeutic order and the principle of vis medicatrix naturae. So we consider not only the root cause of disease, but also the body's current adaptive process. We ask not just what's out of balance, but also how is the body already trying to heal and how can we support the body in that process. Functional medicine training does vary, so some practitioners will take a weekend or a year-long certification course. In contrast, naturopathic doctors undergo 4 years of full-time medical education at a CNME accredited institution with extensive clinical rotations and training in the basic sciences, so anatomy, physiology, biochemistry, diagnostics, and all major naturopathic modalities. So I always say to patients, we went to 4 years of medical school, but then we also have 4 years of philosophy, clinical nutrition, homeopathy, herbalism, counseling, right? So I do usually see when patients come in and they've worked with a functional medicine provider that they have done a protocol driven work with that provider. So maybe they've used a supplement plan for adrenal fatigue or gut issues. So naturopaths might be doing some of these same things, but I do find that I resist a little bit that plug and play model. So I really am using individualized care and tools that are in alignment with the person's vital force and healing stage. So you're not going to treat a diagnosis the same in everyone because you're not treating the disease, you're treating the person that has that disease, right? Many functional providers are doing absolutely incredible work. I am grateful that they are out there. I just want to explain a little bit more what the difference is and the distinction. I do think that sometimes there is a lack of this understanding of the therapeutic order and the vis, that healing force within, and labs can at best sometimes become another layer of overwhelm. And chasing a lab or trying to find the exact right protocol or supplement is very often missing the whole person treatment. So the public confusion around this is very understandable, right? We live in an age where anyone can take a weekend course and call themselves a wellness coach or holistic health expert or even a functional medicine provider, right? So when someone sees that I recommend nutritional changes, they might think, oh, so you're a nutritionist. Or when I use homeopathy, they think, oh, you're a homeopath. When I support them emotionally, they'll often say, oh, I didn't realize I was coming in for therapy. But here's the truth. Naturopathic doctors receive education in all of these disciplines throughout our 4 years of medical school. So because we have 4 years of clinical nutrition, botanical medicine and pharmacology, counseling and mind-body medicine, homeopathy and hydrotherapy, physical medicine and diagnostics, we're pulling from a really big toolbox. There's lots of different tools that we can utilize with each patient, and those protocols will look different for every patient. So we're integrating these within a therapeutic order and a clinical reasoning model that is grounded in both science and tradition. If you visit the website for the AANP, which is the American Association of Naturopathic Physicians, you'll see naturopaths or licensed naturopathic doctors are trained to diagnose and treat illness, to perform physical exams and order labs and imaging while prioritizing non-invasive natural therapies and patient empowerment. So not everyone using the title naturopath online is trained or licensed. So you do want to look for a licensed naturopathic physician. And I think this is part of the confusion and why patient education matters. There's also a really big difference in scope of practice state by state. So for example, in the state of Connecticut, I don't prescribe, even though I had to take pharmacology. And in some states, my license does allow me to prescribe. So if I've spent over 10 years working with patients without using a pharmaceutical, I'm going to get really really good at helping their body heal without a pharmaceutical. Again, there's not a right or wrong. I'm not making a judgment call, just calling my area of expertise nature cure vitalistic medicine is true because that's what I've used all these years to work with patients, right? Whereas if I practiced in a state where I did prescribe, I might be working through that therapeutic order in a different way just because of what tools are available to me and what tools I'm going to emphasize. Additionally, the way that I was trained in our training in philosophy and our working in clinical rotations with mentors and elders allowed me to experience the profound healing power of nature, to see that in action, right? And if you take a course or a certification and you've never really worked a patient through how the body heals, the order it happens, what that looks like, it's going to be a very different experience. And when patients come in, we're so programmed in our society to want a quick fix, right? We want to take a pill. I have patients even who come see me and we do some work together and they feel amazing. And the moment they start to slide back at all, they panic. Well, what's going on? This is bad, right? It doesn't mean it's bad. It means your body's telling you something, or there's something that we haven't really fully uncovered or that's lingering or that we haven't really worked on, right? So I think we have to also reframe our expectations a little bit. And when I start to work with new patients, a lot of the work that I'm doing, again, is really on kind of deprogramming the expectations around what it means to work on our health and what that doctor-patient relationship actually looks like and how much effort and work the patient is going to be doing, right, on their end. And I think one of the keys here is trusting the medicine. If an ND is trained in vitalistic medicine and healing in school, and then they go on and work as an apprentice or a preceptor or associate or do a residency, then they've gotten to see the medicine work. Again, if you spend time working with patients naturally and you're not relying on a pharmaceutical, you're going to get really good at that, right? Hydrotherapy works, homeopathy works, botanical medicine works, diet and lifestyle changes work. They're foundational in what I do. But you have to know how to use these things. They're simple, they don't hurt people, they help people. And this is truly how you heal, how you work with your body, with diet, with hydrotherapy, with homeopathy, with herbal medicine, with your hands, with physical touch, listening and counseling. These are the primary tools that I use as a naturopathic physician licensed in the state of Connecticut, where I don't prescribe. So I really had to learn how to do these things with patients and how to teach patients how to do them at home. I had to trust the medicine and not be pushed by a patient's sense of urgency, right? Like, I get it. I've had health issues that I want resolved. We are innately going to be driven as humans to fix a problem or solve a problem that's uncomfortable. And we really can't let that urgency or even our own practitioner fear that something isn't going to work rush the process. Healing takes time. And I'm not saying to go too slowly. Sometimes our medicine is really quick and fast, but it does take listening. It does take understanding what the body needs. And I think there is this level of confidence that this type of medicine does require. So I am so grateful to my mentors and to elders in the field who have shared this with me, who have taught me, who have allowed me to come in and witness this with patients. This has really been key in my journey. And that's why I'm hoping to have as many of them as I can on the podcast. So I want this episode to really call out in a loving way that shadow side, right? So the dangers of green allopathy. I think even in the natural health world, we often see this tendency to suppress symptoms. And as a new practitioner, I felt that urgency from patients of like, they want me to fix this, right? And really that's partly my ego coming into play there. You have to work on that and you have to engage in the conversation with patients around, okay, what is your body telling us? What patterns have there been over time that we can start listening to instead of just getting rid of the symptom right away? And I'm not saying to suffer. I've said this before. We absolutely will be alleviating pain, but we also want to do no harm and use the least invasive intervention and give the body the conditions that it needs to heal. The body knows what it needs to do. So a lot of the times we're just trying to get out of its way. Just because you're using a natural supplement and it's not a drug doesn't mean it's aligned with the body. So If you replace your Prozac with 5-HTP to support serotonin without addressing the emotional roots or nervous system state, then that's green allopathy. Or if you take a digestive enzyme forever without removing gut irritants or removing food sensitivities or allergies or healing the terrain, then again, you're just practicing this plug and play version of natural medicine that's really very similar in suppressing symptoms and not learning from what the body has to say to you. Even if you're running an advanced hormone profile and at least testing hormones, right? And you start 6 hormone supports at once without clearing the emunctories, which we talked about in our last episode, and without addressing the cortisol rhythm or HPA axis, again, that's green allopathy. So naturopathic medicine reminds us that timing matters, that we do need to tend to our terrain, right? Our terrain's like a garden. That's why we talk about the seeds of health. There's effort that we need to put in to take care of our bodies and our minds. And our body is already doing so much work on the inside. Our job is to support it. Supplements are in addition to support, in addition to taking care of your body, in addition to eating healthy foods and moving our body and hydrating and connecting with something bigger than ourselves and having community and support. We're not taking natural things to override the processes that the body is doing. So we really want to move from suppression to collaboration with the body, from just relying on protocols to being present with and providing a safe space to the body for it to heal. So very often patients will say, what do you do for this? What do you have a protocol for that? Yes, I know what I might do for this or that, but it's going to be different in each person. It really, really, truly is. And this is such a big paradigm shift that sometimes it takes time for those words to really register and for a patient to experience what that means. And again, if you're not just relying even on natural protocols, if you're learning how the body heals, what does the body need? What do you tell that patient to go do? What wisdom has been passed down from elders to you as the practitioner to then educate patients on how do we work with nature to heal versus, again, that symptom suppression, even if it's using a natural therapeutic agent. So in order to highlight how this really plays out in real life, let me tell a little story, because philosophy only matters if it translates into change and transformation. I love talking about philosophy, but I recognize that you need to find where that kind of hits the pavement and what exactly are you asking a patient to do, or it's just this like lofty cerebral intellectual conversation around the philosophy of healing. So a few years ago, a woman in her early 40s came to me. Let's call her Sarah. She had been to a few functional medicine doctors. She brought a thick binder in with her, which I do love data. I loved having that information. And she had lab results that included a Dutch hormone panel, a GI map test, which I tend to run a GI effects by Genova, but she had the GI map test, which I'm familiar with. She had blood work done and some food sensitivity panels done. And she had been on a lot of supplements. She had her bags of supplements, and lots of them were expensive. She was on adaptogenic herbs, some hormone creams, and she had done gut protocols, she told me. She was still exhausted, and her main symptoms at that point were bloating, anxiety, low libido, fatigue, and this sense of disconnect from her own body. And she definitely felt like she had been doing everything that she had been told to do, and she wasn't seeing results. And mostly the feeling that she was expressing to me was fear. And she was really scared. She was scared that she was broken, that she would never feel normal again, that she'd never feel like herself again, and that maybe healing just wasn't in the cards for her. And this breaks my heart when women feel this way, especially when they have run lots of labs and spent time and money on what they think are root cause protocols, right? They think they're getting to the root of it and they're not feeling better. So it can be a really discouraging place to be. And this was the time when I felt it was so important to introduce her to the concept of vitalism and what it meant to be a vitalistic practitioner. So Again, I love tests. You've heard me talk all about them, but I specifically said to her, we're not running more tests. Of course, I had that data, so I felt like I could at least get my eyes on that and see any patterns that had been missed there. But we were not doing more testing. We were not focusing on a protocol. We were not focusing on a diagnosis, but we were really starting with listening, with I was listening to her. I was providing space to listen to her story, to her experience. And then I was working with her on learning how to listen to her body. So the first thing we did was I had her shift her morning routine to align more with her circadian rhythm. And we practice what I call in my Seeds of Health journal the root to rise and shut down to reboot. So we built meals that supported her blood sugar and mitochondrial health. We introduced things like castor oil packs for liver and lymph drainage. And we did something that no one else had suggested to her, and we paused. We paused everything. We did stop a lot of her supplements. I never take a patient off of any prescriptions, but she was not on anything prescribed, so I didn't have to tell her that she had to work with her prescribing provider to come off of anything, but we did stop a lot of supplements. Most of them had been self-prescribed at that point. She was kind of reading everything she could after working with practitioners and not getting results and seeing if she could figure it out. And again, that was really feeding her sense of overwhelm. And we supported her emunctories, those organs of elimination that we talked about in our last episode. We focused on regulation and repair, on feeling safe in our body and nervous system. We used hydrotherapy and daily nervous system reset tools and really gentle plant medicine that aligned with her constitution and her patterns, not just what we saw in her labs. Within a few weeks, she reported that she was sleeping deeper and she felt like she had more energy when she would wake up in the morning. Her bowel movements were more regular, and she said, I feel like my body is responding, not just reacting to the things that I'm doing for it. And that's the vis at work. That's what happens when you listen to the body's timing and to its messages, not just suppressing it and overriding it. I'll give another example. This is actually a younger patient. So she was an 18-year-old, very different case, an 18-year-old girl, and she came to me with chronic IBS and panic attacks. And she also had really bad PMS and period pain. So she had been told that she might need an SSRI and likely hormonal birth control. So we did start with a stool test. We did start our conversation around the gut-brain axis, not just for data, but to show her why her symptoms really made sense. And we talked about the gut-brain axis. We talked about vagal tone, about what happens when stress chemistry lives in the belly. And we did a lot of gentle biotherapeutic drainage in the beginning, gemotherapy, and cranial sacral therapy. And we rebuilt her sense of safety in her body, in her gut, in her breath, and in her emotional body. And the most powerful shift for her didn't come from a pill. She didn't even have dysbiotic bacteria or overgrowth. We didn't do any RID plans. It really came from her realizing that her symptoms were not random, that her body was not wrong, that she could trust it, and that the flares were signals. And now she had tools to respond to them and to work with her body. In both of these cases, and so many others, the healing didn't begin with the test results, although that does sometimes help validate a patient's experience. But it began with a reframe that the body is wise, that the symptoms are messages, not malfunctions, and that healing doesn't always look linear, but it is possible. And this is what it means to practice the therapeutic order, to walk alongside the vis, to be in relationship with the body and mind, not in control of. And this is what it feels like to work with a vitalistic ND. I'm so excited to have some more guests on the podcast. And I really especially wanted to focus on vitalism, on nature cure, because I think sometimes it gets lost in translation in this wide world of functional medicine and all the different holistic or alternative modalities that you might hear or learn about. So very often when I'm trying to highlight this difference to people, I'll use this analogy or tell this story. Now imagine you're waiting for a bus and you're standing waiting for that bus to come and you hear something behind you and it sounds like there's someone upset behind you. So you turn around and you see someone sitting on the bench, and let's imagine it's an older woman and she's crying. And she's not hysterical, but she's exhibiting quite a lot of emotion and she's making noise with her emotion. So maybe you hear a little sniffle or you hear a little outburst, however, she sounds crying in your story in your mind. And so you can imagine if you go and sit down next to her and you're just trying to get the crying to stop, you're not ever really understanding where the crying came from. You're not introducing yourself and making her feel safe and comfortable. You're not asking questions about it. You're just asking for the crying to stop. So, a lot of the work that I do with patients is sitting down on that bench with them and asking them their names, asking them where they came from, where they're going, asking why they're upset, and not necessarily trying to get the crying to stop, but understanding what the crying can tell me about that person and what the next steps might be based on where they're coming from and where they're trying to get on that bus. So it's just a different paradigm. It's just a different worldview. It's a different way of interacting with patients. And each decision, each step, each change that I guide patients through is really rooted in these philosophical principles and in that therapeutic order, which I think is a really big difference between when you see a licensed naturopathic physician who is trained at a 4-year accredited school and trained by elders who know the philosophy versus a functional medicine provider. There's a time and a place. I'm really not trying to offend anyone who comes from a different worldview or paradigm. I think that patients can achieve healing in so many different ways. Everyone's journey is going to be different. There's not a right or wrong. And it's really not one size fits all, but I want to introduce this difference because it's a question that I hear every single day. So the next time you hear the words naturopathic doctor or naturopathic physician, I want you to think about this. This is a lineage. It's a sacred remembering, and it's a commitment to walk beside the body, not to battle it, to sit down next to it, to ask it what it needs, to learn about it, and to help remove the obstacles to cure and to create the conditions for health. It's rooted in reverence for the vis, in rhythm, and definitely in relationship. And I think that it's the future of medicine, not because it's new, but because it's ancient and enduring. So thank you for being here with me today. If this episode sparked anything in you, you can go back to episodes 1 through 3 for deeper exploration of the 6 principles of naturopathic medicine, the therapeutic order, and how we reclaim healing through foundational rhythmic care. Until next time, I'm Dr. Kelly Livingston, and I'm so glad that you were here today.